Hi, my name is Dr. Robert Kaufman, and we're about to go beyond the terminus. One of my viewers kept asking me, why do I keep pulling out my cones during the middle of obturation? If you're frequently removing gutta-percha cones during obturation, you may notice that minimal or no tugback is associated with these high rates of cone removal during packing. This is caused by inadequate shaping of the canals and excessive parallelism rather than taper. It means that you have inadequate deep shape and you need to increase the taper of your canals slightly to prevent this from happening. Newer, more flexible, slender, NiTi engine-driven instruments allow for preparation of canals that are much thinner than the traditional warm gutta-percha-related shapes. Tugback is much harder to achieve with these shapes, and removal of the gutta-percha cone during the obturation is much easier because of this. For that reason, I suggest you increase your deep shape by finishing with a slightly larger file. You will immediately notice better tugback and less chance of cone removal during obturation. One other factor is the cones that you're using. You should try to use cones that correspond as closely as possible to the shapes that you're creating with your instruments. Most instrument manufacturers sell corresponding sized gutta-percha cones that are meant to be used with their created shapes. In situations where they don't fit as well as you'd like, you can always use a larger cone and then adjust the shape by using a cold rolling technique, which I show you in one of my other videos. There's no doubt that the original hand file created shapes advocated in the 60s and 70s didn't reflect an appreciation for the remaining dentin thickness and the need to conserve tooth structure. As our instrumentation technology has improved, we have become much more aware of the need for preservation of the tooth structure. Is there a middle ground? Yeah, I believe there is. Preparations that allow us to create shapes that address more conservative cleaning and shaping of canals, while at the same time still taking advantage of the ability to mold gutta-percha in the canal with heat. The idea is to get the maximum amount of gutta-percha in the canal space during your obturation and slowly move the softened gutta-percha mass down the canal space like an elevator. In order to properly move gutta-percha in the canals, there has to be sufficient bulk to allow the gutta-percha to accept the heat. When I discussed gutta-percha cone fit in my other video, I emphasized that more slender canals require cones to be fit closer to the working length because it's so much more difficult to move the gutta-percha cone in these slender canals. Let's not fool ourselves. With these extremely small, slender canals, you're essentially using a single cold cone and a sea of sealer at the apex. Why? With these small shapes, there's really no way to transfer the heat in the classic warm gutta-percha compaction method. It was for this reason that Dr. John Stropko, a fellow BU alumnus, developed what is known as the System S, or a gutta-percha gun-based obturation system. For more information on how to do this, check out my other video that specifically deals with System S obturation. In extremely large canals, such as in younger patients, it's best to custom roll a cone, which I showed you how to do in a separate video. Once you gain experience with packing cases, it's amazing the kind of control you have over this material. In cases with large apices or apical resorptions, I will frequently fit cones shorter than normal and gradually move the material into place. It helps to take images during the downpack to gauge your depth of obturation and the position of the gutta-percha. We also have to remember that heat application only goes so far, and that we need to resist the urge to apply vertical pressure on the heat carrier to the point where the heat is transferred to the midpoint of the root, but not to the apical portion. It still stays cold. That can result in pushing of the cold apical portion of the cone out the end of the tooth if your apical cone fit isn't as good as you think. The timing of application of heat is also important in the technique. We want to warm the gutta-percha mass slowly and obtain the thermal profile seen in this graph in Schilder's article in Gerstein's textbook. By gradually increasing the temperature of the gutta-percha apical to the application of the heat with the heat carrier, we can cause deformation. Many clinicians do not understand the proper packing technique of canals. They tend to pack the gutta-percha with a plugger in the same manner that they pack amalgam, sort of a tap, 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 tap. That's not correct, and bouncing the plugger on the gutta-percha material doesn't assist with its movement. Proper use of warm gutta-percha technique dictates that the plugger is inserted into the softened mass and then held there in place for a few seconds to allow the gutta-percha to move with the pressure. Again, this can only happen if there's sufficient bulk of gutta-percha, and it's virtually impossible to perform if canals are so slender that the pluggers bind in the canals or the pluggers don't reach deeply enough in these slender canals. The only time that you want to have the head heat carrier turned off is when you have inadvertently left gutta-percha on the sidewalls. In that case, turn the button on to activate the heat carrier, contact this material, and then turn it off. The material on the sidewalls will freeze to the carrier, and then you'll be able to remove the excess, leaving the deeper, flat gutta-percha surface ready for the next pack motion, without being deflected by the remnant gutta-percha on the sidewalls. It's also important to have appropriate sized heat carriers for the canal. Slender canals require thinner heat carriers. Larger canals require larger heat carriers. You can't just use one size. Using too small of a tip will only pierce the gutta-percha and not bring out the segments as the technique requires. You'll leave material on the sidewalls. Too large a carrier will not allow you to place it sufficiently deep and far enough into the canal to heat the material. The least common problem is having your heat carrier freeze on the gutta-percha because you allow the carrier to cool and the gutta-percha cone sticks to the heat carrier as you remove it. This problem is easily avoided by making sure the heat carrier button is on and always activated when it's in contact with the gutta-percha material in the canal space, especially prior to withdrawal. You want that burst of heat to make sure the heat carrier separates from the cone. Thanks for joining me on this version of Beyond the Terminus. Remember, when we do the right thing, not only do our patients get better, but we do too. Please remember to like and subscribe. This channel is not sponsored by any commercial entity and relies upon you to help spread the word and to make it grow. I look forward to our next trip when we go beyond the terminus. See you then.